And coming up next, millions depend on them to see clearly, but wear the contact lens wrongly and you might end up not seeing at all. A global expert shares his do's and don'ts right after these messages. If you hate to wear your spectacles and prefer contact lenses instead, then well, you are one of about 125 million people worldwide who choose to do that, inserting the thin, curved plastic disc over the cornea of the eyes for better vision.
That's right, but doctors are seeing an increasing number of contact lens wearers who use them wrongly, damaging the eye in the process. Professor Linda Jones from the University of Waterloo Center for Contact Lens Research says there are also myths surrounding their usage, which he's eager to dispel.
He's in town for a one-day symposium for eye care professionals, and we asked Professor Jones what these myths are and the correct way to wear your lenses. Good morning, and thanks for joining us at our studios. Prof. Jones, let me start by asking you, what are the most common myths regarding the use of contact lenses?
Well, there's all kinds of myths about contact lenses, some of them relating to the fact that you can only wear them for a set period of time. I know that some patients think that if you start wearing contact lenses at an early age, then maybe after about 10 or 11 years, then you can't wear them anymore. And that's really incorrect. The types of contact lens materials that we now have available are the safest and best that we've ever seen. They allow amounts of oxygen to the eye, which really, as far as the eye is concerned, means that there's no contact lens there at all. So we certainly see no limited time to the numbers of years that you can wear contact lenses.
Let's talk
some
about
of the other myths... Carry on.
Sorry, let's talk about the types of lenses then. We've got the soft one, which most of us use, and then the hard lenses. Yep. And we've also got the so-called permanent one, which you sort of use it and dispose it in a year, and the daily disposals.
That's right. Yeah, I mean, there are a vast option of contact lens materials available to people these days, and really you can kind of break those up into the hard lenses, which was where contact lenses started really back in the 1940s, compared with the soft lenses. And probably 90% of the contact lens patients in the world now wear soft lenses. Very easy to adapt to, they're very comfortable, and the newer materials, these materials called silicone hydrogel materials, transmit about 5 to 6 times more oxygen than any other type of contact lens material that we've ever seen before. Within those soft lens categories, pretty much the differences that you see are lens materials that you wear for up to a year, the lenses that are not disposable, and then within the disposable group, lenses that you replace somewhere between 1 day and up to a month. And we have very good evidence to show now that the shorter that you wear lenses for and the more frequently you replace them, the safer they are. So areas like Singapore, for example, have a very good usage of the daily disposable lenses. That's actually the contact lens that I wear myself. And we know that daily disposable lenses are incredibly safe. They have the lowest risk of eye infections, and really, compared with spectacles, the risk is infinitesimally small compared with wearing spectacles.
Well, let's talk about that for a moment, I guess. You're saying it's the best to use. Why is that so? I know it's because of the build-up, is that right? In terms of the bacteria and germs and protein build-up?
That's right. I mean, what's important, I think, for people to remember when they wear contact lenses is that contact lenses are a medical device. They can create problems if you don't use them properly. So that as soon as you take a contact lens from a packet and you put it into your eye, components of the tear film, so oils and proteins and all kinds of other things, along with bacteria, can attach to the contact lens. So the great thing about using a daily disposable lens is that you have a brand new, fresh, clean lens that you insert every day, so you avoid those build-up of things from the tear film. And also, so long as you remember to wash your hands, and that's a problem, unfortunately, that some patients do forget, washing hands, and no point having a brand new, sterile lens if you don't wash your hands before you put it in. But so long as you wash your hands, then the contamination of those lenses is almost nil.
What about the contact lenses we see these days, the colored lenses? You know, a lot of Asians here, you know, try on the blue lenses, the brown lenses. Are they as safe as the transparent ones, or are there considerations you need to take into account?
Well, the major consideration is, again, I think that people tend to think of them as being more like cosmetic things, and they're not. I mean, they really are medical devices. So, you know, I hear horror stories of people buying a contact lens and then saying to their friend, hey, I've got these blue contact lenses, would you like to borrow them from me? That doesn't work. Really, patients should remember that they are pieces of plastic that can cause problems if you don't use them appropriately. But used appropriately, and patients, so long as they remember to use the appropriate contact lens solutions, remember to replace those solutions regularly, remember to replace their case regularly. That's another area that unfortunately patients forget, is that the contact lens case can be very easily contaminated with bugs. So long as people do all of those rules, then colored contact lenses, again, are perfectly safe.
And what about, I know in the past, say wearing contact lenses overnight, you shouldn't sleep with them, but then now there are some lenses that market themselves saying you can wear them, non-stop for 7 days, for 2 weeks.
That's right. Well, in fact, there are some lenses on the market now that you can leave in for up to 30 nights. They're approved for use in that way. And again, those materials are certainly much, much better than the previous lens materials that we saw, particularly the silicone hydrogel lenses that allow so much more oxygen through to your eye. However, we still need to bear in mind that if you do sleep in a contact lens, even the best type of contact lenses, we're still increasing the chance of us getting an eye infection by about 10 times. So whenever possible, there are situations where people, for example, for an occupational reason, if they're a firefighter or an ambulance worker where they do need to wear their lenses for extended periods of time, those occupational reasons are pretty good reasons to wear these overnight lenses. But in the vast majority of cases, I personally would prefer that patients use them on a daily basis and replace their lenses at the end of the day, and either throw them away as they do with daily disposables, or throw them away at the end of 2 or 4 weeks using solutions.
Professor, we're running out of time. Very quick question. There's some people out there, when they wash the lenses, they think that tap water is good enough. Is that really true, or should you stick to the solutions?
Absolutely no tap water at all. Tap water should never come in contact with contact lenses. It should also never come in contact with your contact lens case. Tap water, you're never quite sure of the source of it, and again, we have very good evidence to show that one of the major risks of contact lens wear is where patients actually use tap water associated with their contact lenses. So absolutely no tap water at all, Susan.
All right, thank you so much for that, Professor Jones. So I guess you use the solutions to wash the cases as well.
Right. Yeah. And just good hygiene habits. I want to thank Professor Jones for speaking with us this morning.